Let's keep talking about what's happening with COVID and the different vaccination schedules in different parts of the world. As we invite into the stream Dr. Tom Tsai, Senior Fellow at the Harvard Global Health Institute, Assistant Professor in the Department of Health Policy and Management at the Harvard T.H. Chan School of Public Health. It's good to have you here, Dr. Tsai, and good to see you once again. What do you make of the fact that we've got 100 million, at least one shot into the arms of Americans, but we have at least 200 million more Americans to go? What's a realistic time frame?
I think the timeline from the administration is very accurate, that by the end of May, the majority, if not most of all Americans should be able to have at least their first dose of the vaccine. And the rollout has just been phenomenal over the last several months. On our website, globalepidemics.org, which is a collaboration between Harvard University and Brown School of Public Health, we have a tracker, and it's been great to see that thermometer hit the top, reaching that 100 million vaccines administered well within the first 100 days. And I think we're right on track as we're vaccinating over 2.5 million individuals per day. But the next challenge is not just about broadening the eligibility for vaccinations. It's really about the last mile. Is do we have the technological systems in place to ensure that there is a speedy registration and pre-registration of individuals, and making sure we can get those remaining shots into people's arms. But I am very optimistic that we'll be on track to be able to hit that target by the end of May.
Dr. Tsai, what about the case count? Because we've seen cases plateau recently after declining for several weeks in a row. Why are we seeing this stall right now?
I think part of the challenge has been the focus on vaccinations has taken our eyes off the ball in terms of a focus on testing. Testing still remains an incredibly part of the overall strategy. And my worry is that we're in the end zone right now, and I don't want us to fumble the ball before we score the touchdown. So yes, even though over 100 million people have now been vaccinated, the overwhelming majority of America has not been vaccinated. And in order to make sure we still protect those individuals, we still have to follow through with common sense guidelines like masking and avoiding high-risk situations that may lead to infections, especially among individuals who may not already been vaccinated. It's been very encouraging that the guidelines have been relaxed for people who have been vaccinated to have at least a sense of more normal social interaction, but we're not out of the woods yet. And the plateauing of our case counts over the last several weeks has been concerning. We've stalled a little bit in terms of coming off of this most recent peak. We're still averaging around 55,000 cases per day. I want to see that case number keep going down.
Dr. Tsai, there was an article, it might have been the Wall Street Journal, I'm not sure, but it showed that in Israel and in the United Kingdom, the data seems to indicate that one dose of those vaccines that might require two seems to be sufficient at helping bring down all of these curves that we keep our eyes on, and that you can delay the second dose. Is it time for us to reassess in the United States our regimen of, nope, got to get both doses before we start broadening?
That's an incredibly important point, and I think it is the time for us to reassess that. The data, and it's not just in news reports, but in studies that have been published in the most esteemed medical journals, have shown that even a first dose in the real world can reduce the rates of both symptomatic and asymptomatic cases of COVID-19. So the key priority right now is to get as many first doses in people's arms, as the effect of the vaccine seems to take effect around 12 days after that initial injection of the vaccine. But there are other important goals that we still have to be transparent and accountable to. So it's not just about the overall number of vaccines, is how well we're rolling it out for really the vulnerable populations. We've done a good job in our long-term care facilities, but we can do better for those residents as well as the staff. And the third part is the overall equity of our rollout. We're still seeing that white populations are still getting a higher rate of vaccination versus racial and ethnic minorities. So it's really not about the individual grades for each of those three metrics, but what the grade point average is of our overall vaccination strategy.
Speaking of grade point averages, Doctor, I want to ask you about schools. The CDC issuing new guidelines this morning saying 3 feet, not 6 feet inside the classroom. Is this a green light that schools needed in order to reopen faster?
Absolutely. We've been part of a broader nonpartisan group of researchers and public health officials working through the COVID Collaborative, and it's been led by Harvard and Brown to bring together all the key stakeholders, including nursing unions and education leaders and school administration leaders and parents associations to really come around a consensus of how the data has evolved. And the data has evolved to the understanding that the focus should be on effective infection control within schools. And if there's effective infection control, including ventilation and wearing masks, then it is safe to have in-school distance of less than 6 feet, so now 3 feet per the new guidelines from the CDC. So this is a paradigm shift from thinking just about community level risk to thinking about preventing transmissions within the school. And we can do that. We know what to do. We've known what to do for months. And it's really about developing the trust with our school leaders and teachers and parents and students to implement these strategies. We were working on a guideline to launch by April 1st with the idea that we can get as many children learning in school once again by May 1st.
Dr. Tom Tsai is a senior fellow at the Harvard Global Health Institute. Thank you for joining us here on Yahoo Finance Live. We look forward to seeing you again.